Hello everyone. So today we will discuss about the reproductive toxicity studies in male. Okay. So reproductive toxicity studies are divided into two categories. Okay, first in females and second one is males. So here in this topic we'll cover the reproductive toxicity studies in male only. So this topic is coming under pharmacological and toxicological screening methods 2, which is coming under MPharm second semester pharmacology. Okay. So, what is the definition of reproductive toxicity studies? You can see that it is a study of potential adverse effect of an agent in the structure and function of organ or organ system involved in the reproduction. Means here we are identifying whether a substance is having any particular effect in the organs or organ system that are involved particularly in the male reproduction. मीन्स यहाँ पे हम ऐसे सब्सटेंस जो भी हम लोग यूज़ कर रहे हैं उसका इफ़ेक्ट हम लोग देख रहे हैं कि हम लोग के रिप्रोडक्टिव सिस्टम में इन्वॉल्व होने वाले जो ऑर्गन्स होते हैं उन पे क्या इफ़ेक्ट हो रहा है उस सब्सटेंस का. ओके. सो सेकेंड वन इज अप्रोचेस टू मेल रिप्रोडक्टिव टॉक्सिसिटी टेस्टिंग. मीन्स हम लोग कैसे आइडेंटिफाई करते हैं. मीन्स इफ़ वी आर यूजिंग एनी पर्टिकुलर सब्सटेंस देन हाउ कैन वी आइडेंटिफाई द इफेक्ट ऑफ दैट पर्टिकुलर substance or reproductive system organs. Like we'll check the effect of chemical on fertility, we'll check the changes in fertility. Means if substance is having any particular effect or can say having negative effect towards the reproductive system in male, then it will definitely affect the fertility in male. Then after the effect in specific cell type, then testicular function and sperm assessment. So these are all the parameters that will be measured by us if we are identifying a particular effect of any substance over the reproductive system. For example, if we are using cimetidine, cimetidine is which class of drug? As we already know that it is an histaminic H2 antagonist. Okay. So if we are using cimetidine type of drug, then it will affect the sperm count. And then after, if we are using heroin, it is an opiate analgesic, then it will affect the sperm normalities or can say cause sperm abnormalities, right? So next one is principle. Means what is the principle that we are following in this procedure where we are identifying a effect of any chemical on reproductive system. Here the test chemical is administered to several group of male or females. Okay. Means we are administering our particular substance, like we can take example like cimetidine or heroin or any other drug substance. If we are using, we will simply administer a specific dose of that particular substance over both male and females rats. Then males should doses for minimum 4 weeks. It is an important step. Like males should be doses for minimum 4 weeks, and after 4 weeks we'll do the histological examination of testis. Okay. Means then after we'll check the histological, means we are doing the examination of testis of that particular rats. Then check the effect in fertility in with spermatogenesis. Spermatogenesis means a production of sperms, and fertility, etc. Then housing and feeding. Means if we are using any particular animals in our experiment, then what the criteria that will be followed in housing and feeding. Then the temperature should be 20 degrees Celsius and humidity should be 30%. Artificial light will be provided. Laboratory diet should be given to animals. Not more than 5 animals in single cages. Means if we are placing animals in our cages, then not more than 5 animals are included into a particular cage. Then what is the procedure? Firstly, 10 males and 12 to 13 females will be included in this experiment, and then animals are tested with test chemicals for 7 days. Means we are giving test chemical to particular animals, means 10 males and 12 to 13 females for 7 days. Then we are talking about the reproductive toxicity studies in male particularly, right? So we'll specifically focus on male fertility. Here we select the rodent rats and 3 dose groups should be taken, and each and every groups will contain 6 adult male in each. Okay, then drug is treated, means we are giving drug to all the rodents that are divided into 3 groups, and each group will contain 6 adult male, and give drug for 4 weeks. And after 4 weeks we will mix females, 10 female, that we already know that we have taken 10 males and 12 to 13 females, right? So we will do a mixture, or can say make a mixture of males and females in a ratio of 1:2. Okay, then in 1:2 ratio females and males will be living together. Okay, and then after some days, in upcoming 13 days, we will measure how many numbers of females are getting pregnant by male rodent rats. Okay, and after a pregnancy determination, will sacrifice all the male rats particularly. Okay, then after the sacrificing male rats, we'll check the effect of testis epididymis records means epididymis cells. These are the type of cells that are responsible to make sperms in the testis. Okay, then sperm motility and morphology means the structure of sperm, means how it is functioning, motility, etc. And at the end, we'll do the observation studies like sperm motility, morphology, histopathology, weight of epididymis, and the pathological changes. So this is a brief description about reproductive toxicity studies in male. So keep in mind that this is only particular for male. Okay, so thank you.